What's wrong, Brian?
Brian!
Oh, what's his name?
Brian Lozer, age 16. Symptoms include headaches, loss of weight, increased appetite, and eating frequently.
So?
Well, his parents brought him in when they found him in his bathroom puking, and that was before he fainted.
Oh, fine. Let's go see what we have. So, your head hurts and you eat a lot?
Yeah, I'm always hungry.
Nurse, can I see outside for a sec?
Okay.
I think this is just a case of adolescence. Let's just tell the kid to suck it up and go home.
But how do you explain the loss of weight? Oh my gosh, the patient's heart is failing.
What happened to him?
I don't know. No one was even in the room with him.
Get the crash cart. Clear.
It's not working.
I know, turn it up. Clear.
He has a pulse.
Okay, he's stable. Put him on an AC inhibitor.
What will that do?
It'll lower his blood pressure and build up his blood flow.
Okay.
Hello, Mrs. Bozer. I'm Dr. House.
Do you know what's wrong with my son?
Not yet, but we're going to run some tests to see if we can find the problem.
Is he going to die?
I really don't know at this point, but he's stable and he's still not looking too good. Do you see that?
He's bleeding.
That means he has gingivitis in his gums.
So what could this possibly be?
Gingivitis, weight loss, headaches, hunger, and eating all the time?
Well, we can rule out any diseases that involve the urinary system, the nervous system, or the respiratory system.
What about the digestive system? Besides the gingivitis, the other symptoms pretty much fit the disease involving the stomach.
But the gingivitis still doesn't make sense.
Well, let's see how much more we could find out about the mouth then. Complete a full dental exam.
And what am I looking for?
Anything at this point.
Hold still, Ryan. This will only take a minute. I noticed a few things. The enamel of his teeth were eroded, there were traces of stomach acid in his mouth, and there were cuts in the back of his mouth towards his throat.
Ugh, how could we miss this?
Miss what? What does all this mean?
He's making himself sick.
How?
You're bulimic. Which means you've been making yourself sick this whole time.
I didn't know what caused all this. I just wanted to help.
Well, you thought wrong.
Brian, I'm going to give you some antidepressants. This should help you get back to normal. I'd recommend that you take them for the next few months. Also, I would like you to go to therapy at least once a week.
Do I have to?
Yeah, and stop puking.
How?
So, you're wrestling, aren't you?
How'd you know?
I could just tell, and the bulimia makes sense.
How do you know why I'm doing it?
Because I used to wrestle, and believe me, I know what it's like to move up a weight class.
I didn't think all this would happen. I just wanted to move down one week.
I know, Brian. I know.